Hello and welcome to this episode of the Lancet Voice. I'm Jessamy Bagenal, a Senior Executive Editor at the Lancet, and I'll be joined today by my co-host Gavin Cleaver and by Editor-in-Chief of the Lancet, Richard Horton. Today we're going to try something new. I mean, I say it's new, it's not really new for the rest of the world because many other podcasts are taking a more conversational and relaxed approach to how they are formatted, but it's new for us. Each month, Richard, Gavin and I will get together to discuss some of the biggest news in health, what we've been doing in the global, public and clinical health space, and what we're looking forward to in the coming month. We hope you find this enjoyable and informative. We'd love to hear from you with any suggestions you have for how this might work better, topics you'd like us to cover, or guests you'd like to hear from. Please connect with us on any of your social media platforms. Our handles are rather uninspiringly just our names. You can hear this podcast on all your usual platforms. Please subscribe.
Rachel, I see you brought a folder of newspapers with you.
I saw you launch the new collaboration with Jack, and I saw on Twitter you giving a speech in a garden, it looked like.
Yes, we were at the Excel Centre is so unpleasant. It was so nice to go to a decent place in Knightsbridge, which is like another planet. And so we went to Knightsbridge into this pavilion, it was called, and then onto this very nice terrace with all of these cardiologists and who are exceedingly well dressed.
Always.
It is
especially
interesting.
the European cardiologists. Yeah. Oh my God.
They are.
They have the different colour, like the different colour of their collars, and their. I mean, it's so.
It's different from the global health community.
What do you mean, different colour of their collars?
So you can have like a blazer. They'll have like a very fitted blazer in like brown, and then they'll have like this bit will be orange, and then they'll have some sort of amazing lining inside, and they wear these nice they look amazing.
Yeah, whereas if you go to the global health meetings, I mean, it looks like people, I mean, I don't even want to say, it looks like people have just woken up in a tip.
Yeah, everyone looks like me at the global health meetings.
Well,
I've been to a few of them.
Yes, right, exactly. It's dirty jeans and a T-shirt, and they haven't had their hair cut for about 3 years, and that's global health. That's what you wear on your.
There's no private practice in global
health.
That's the problem.
There's no. You can't do a few extra angiograms on the side.
Have a certain, look.
Exactly. So I did actually have to put a jacket on for these people. So no, it was very nice. We had the Jack launch, and it was very friendly actually, and we've known them for a long time, the Jack folks. And back in the early 2000s, we were super friendly, and then we went through a period of being not quite so friendly, which will pass over quickly. And now we're back to being good friends again. And so Harlan Krumholtz, the editor of Jack, and ourselves, we're working out how we can exchange manuscripts, do commissions together, and other projects. So it's great, actually. It was a very nice event. And then also we had a session at the meeting where all of our cardiovascular commissions were presented.
Yes.
The ones that we published and the updates on those, and then ones that are being in process at the moment. Yeah, exactly. So that was also.
And that went well.
It went super well. Flavia chaired the whole thing. Good. She did a brilliant job.
Good. And
Chloe was there in support and did a brilliant job. And it was a very lovely, warm event actually. So. Yeah, the ESC was good. So come on, what have you two been doing?
Well, mine is not going to sound as interesting as yours, but it's been August, so I think it's been quiet. I think that's allowed.
An excuse.
I joined a very interesting working group lead meeting for our Sustainable Healthcare Commission. So that's led by Andrea McNeil and Jodie Sherman, and it's been going for about a year and a half. And as we know, healthcare, I think the sort of, everybody quotes this, contributes 5% of global greenhouse gases. And if the whole sector was to be a country, it would be the 5th largest emitter of greenhouse gases. So there's an enormous amount, and everybody's working on how do we make healthcare, near carbon neutral. Incredibly difficult, such a complex system. So I joined a 2-hour meeting of all the working group leads, and there's some amazing work going on there. I mean, really interesting, exciting work. And I think it's important on 2 levels. So it's not just about reducing the emissions for healthcare, but it's also the fact that healthcare can be a kind of vanguard for other very complex health systems, not just healthcare. Everybody's looking at how we can be more sustainable. And I really think this commission will lead the way in that. So that was very exciting.
But there is a paradox, isn't there? Because on the one hand, you've got Tedros saying we've got to have a drive for universal health coverage, which means rightly expanding our health systems and strengthening them and having more facilities and all the rest of it. And how do you make, I mean, when he makes that case and when others make that case, indeed when we make that case, we don't also then have a little codicil saying, P.S., make it sustainable. And what does make it sustainable mean? I mean, it doesn't mean, I don't want to trivialize it, but it doesn't, you can't have every hospital has its own windmill or every hospital has its own solar panels on the roof. So how do you make it, what does sustainable mean in that context?
Well, I think the aim is to go to carbon neutral, as we do for all systems, globally. We have to get there. I'm not sure that it's a paradox, but it's definitely a tension. But when you look across the world, when you look at the, I think there are a couple of interesting points to raise. One is on prevention. So, there's a huge prevention aspect to this. Like actually, if you're not using as much healthcare because you're having more public health interventions, then you can reduce the cost, you can reduce the carbon emissions. But also when you look at what countries are using, if you look at America and England, the waste that we have, the use of interventions, so much greater than other countries who already, there are healthcare community settings in Pakistan who are totally off the grid because they have to be, because they're in the middle of some, mountain region, and actually they have to be able to have continuous electricity. And we published a trial recently about different healthcare settings in sub-Saharan Africa and access to continuous electricity and to continuous water. And it was based on the fact that actually if you've got solar panels or you've got something that is more sustainable, then at least you're in control of it. You're not part of a national grid where you might be having power cuts the whole time. So
I think the point about waste you make is really important, because the amount of waste, especially plastic waste, is enormous. Is enormous, actually.
That's totally, and also, wasted interventions, all of these sort of different fields of medicine, or kind of shoot-offs of medicine, choosing wisely, all these different things that people have been thinking about for the last 20 years. I think they're kind of culminating in what are we actually doing with healthcare right now? What's important for healthcare? Who do we need to treat? How do we treat them correctly and appropriately using the right things, rather than, throwing 50 million things at them in the most inefficient way, or finding things that are irrelevant and then treating them and following them up for 15 years, which is totally unnecessary. So I think there's a whole group of people that are coming together from lots of different fields that have kind of been perhaps working in silos over the last 20 years around some similar crossing themes. And I really think that this commission is going to bring them all into the same tent.
So is that for next year?
We hope so.
We hope so.
It's an ambitious timeline.
Okay.
It does make me think as well the extent. I read an amazing article yesterday about the extent to which solar power is coming on. I've got some amazing facts.
Let's hear them, Gavin.
In 2023, the world installed more solar capacity than it did between the invention of the photovoltaic cell in 1954 and 2017.
Yeah.
The amount of solar capacity in the world has increased tenfold in the last 10 years, and solar power is now essentially approaching free.
Yeah.
In the article, they were talking to an expert who said that if you asked him 10 years ago if it would look like this, he would say you were in a dream world. So apparently the extent to which it's coming on, by the mid-2030s, solar is projected to provide 60% of the world's electricity, whereas it currently provides 8%. And in that time, the amount of solar power that will have been installed, I can see you've got a skeptical face, but let me finish. I've only got one more fact. The amount of solar power that will have been installed is currently 8 times the world's nuclear power capacity over the next 10 years. Richard, so skepticism.
I'm not skeptical of your facts. Your facts, I don't dispute. My worry is that the fossil fuel industry is working like crazy to undermine your vision of where that 60% figure. Because they are still investing trillions of dollars to find new oil fields, new gas fields, and to build up the fossil fuel energy market. There's no sign.
Lobbying the whole time.
Yeah, there's no sign that they're trying to roll that back and move into renewables at all. And some political parties, the Reform Party, which campaigned in our election in the UK, in its advertising, it explicitly stated its opposition to net zero. And there is a growing, look at the results in Germany just this week with the AfD. There are political movements that are gaining ground, which are explicitly positioning themselves against the efforts to get to net zero. So
it's the next populist backlash.
Exactly.
J.D. Vance, right, in Pennsylvania just recently was saying, let's drill. You know? I mean, it's all
Which
about...
has been a Republican motto for decades now, it feels like, yeah.
So, I mean, that's not...
So how do you stifle the disinformation campaign from the fossil fuel industry to allow your 60% figure to be realised, which would be a dream, absolutely. I just feel like we're up against some pretty evil forces here.
Oh, absolutely up against it. But I feel like the only way to do it is to make the economic argument unarguable.
Yeah.
If governments are obviously subject to an extreme amount of lobbying from these forces that you're talking about, but if you're a government looking at installing new capacity that's based on fossil fuels or new capacity that's based on nuclear, but then you look at the price drop over the last few years in renewables to the point where it's no longer something you're doing because it's good to have renewables. It's something you're doing because the economic argument is actually unarguable.
It's cheaper.
It's so much cheaper. It's so much cheaper.
Right.
And
that would win, wouldn't it?
I think that's the only way.
Yeah.
And it feels like that balance is finally starting to tip into actually renewables are not only the best way for the planet, which is one completely separate argument that we seem to keep losing, but the other side of the argument is actually now they're the economic way to go.
But I mean, to your point, I think there's a few different things going on there, isn't there? Because on the one hand, I think it is becoming, and it already has been over the last 2 years, much more of a kind of populist movement. And we see that because of poorly implemented policies like ULEZ, around London, which actually often impact the poorest people. And when you've got an economic system which is not necessarily working for everybody, then that's an easy thing to hold on to. Well, these elites are wanting to go green, but actually that's making me, not being able to drive my taxi to around London or whatever. So I think there's that kind of offshoot. In opposition to that, I do think there's the financial markets who are just massively excited about sustainable. They're going all in, the investment there, like Mark Carney's book. I mean, it's all happening there. It's all being pushed by some pretty visionary financial leads.
But in the background,
I'm sure, are the fossil fuels. But I think your point is right, Gavin, that if you make the economic case, then it's unarguable. But I don't think that it helps this divide. Because actually, the fact that the financial market and all of these incredibly wealthy, rich people are investing in solar panel and are really excited about sustainable energy now, that plays into the fact that there's this sort of divide between the two people. So I think from an economic point of view, I think you're right. But I still think that there's a huge political aspect to this where people are feeling incredibly disenfranchised, and net zero is becoming, or being less carbon heavy or more sustainable is becoming a kind of tool for people to say, well, look at these guys, look at these middle class people who are investing in sustainable healthcare, and there's a divide there.
I mean, we need to make sacrifices is the hardest message that you can politically put forward, because you'll always be met by someone in the opposition who is like, we don't need to make these sacrifices. Actually, if we carry on as things are, everything's going to be fine. In fact, even better, because you won't have to give up any of the things that you like.
But often it's not even made in those terms, is it? There's even not an argument that we don't have to. It's just, well, they're doing that and we don't like them. It's just polarization and people saying, let's just drill, let's just, we love oil, we want to do this. It's not even made. Agenda. Or it's the woke agenda, right? It's not even made in the context of a greater argument about planetary health. It's just, we don't like them and we believe in oil, we believe in not being woke.
A bit like the kind of pretty meaningless phrase woke as it's used across the media now by this point. Net zero is also turning into one of those terms that can essentially mean what you want it to mean.
Yeah, there's been a lot of greenwashing for sure, back to Richard's point.
Yeah.
Net zero.
When you see things...
even in America, there are hospitals who say that they're net zero,
And they're not.
They're not saying they're not net zero.
Yeah.
No, there's a lot of problem with the carbon credits market, for example. But you also see things in politics now, like at one point in the local elections last year, the Conservatives were campaigning on people not having 7 bins as part of their environmental strategy.
Small and big problems.
Yeah.
Well, I tell you, I wish I had one bin. Where I live in London, you wouldn't believe.
I don't think you
honestly,
can. I've heard this from you, Richard. Before. I don't think you can say
I've got to tell you, I am the least green person in this room. Do you know how we deal with rubbish in North London? I have an orange plastic bag into which I chuck everything: glass, metal, recycling, whatever it might be, and then I literally tie the bag up and drop it on the street. I can drop it on the street at 11 o'clock at night or 6 o'clock in the morning.
I think you should cut all of this.
And then along comes a trash truck from Camden and picks up my rubbish. I joke not.
Do they then sort it?
No.
Oh, they just...
That's it, Gavin. That's it.
All of my neighbours, what we do is we literally throw our rubbish onto the streets of North London in the hope and expectation that our council tax will indeed allow a trash truck to come along and pick it up. And of course, I take my trash out at 11 o'clock at night. When I go and buy my newspapers at 6:45 every morning from the nearest tube station, inevitably a fox has come and opened my thing. All my last week's rubbish that I have assiduously collected in this orange bag is strewn across the pavement for everybody to see. I mean, it is the worst system. We are living in London, one of the most advanced capitals in the world. And I tell you, France does everything better, but France does trash better. You actually have holes dug into the ground with metal containers, and you take your black plastic bag and you open it up, you put it in, and then every day a trash truck lifts up the metal container, empties it. There's no trash on the street.
Yeah, Germany has a large container for every single street that you just go to the end of your street and put it in. It's a lot more straightforward. What have I done this week, I hear you ask?
Exactly.
That is what we're asking. That's what we're asking.
I've largely I've been editing podcasts, as you would expect, from my role at the Lancet, in which I am the producer of 20 plus podcasts, so that takes up most of my time. But there's been a few really interesting ones this week. We have 2 podcasts coming out on Mpox. One is coming out on the Lancet Weeklies in Conversation With, which is quite a technical, clinical talk about the difference between the different clades and what clinicians should be looking out for. And we have one coming out
because they present differently.
Yes. And we have one coming out on the Lancet Voice, which you're listening to right now, about the global health concerns and what the situation looks like from Africa with Salim Abdul Karim, who is one of the best placed people to know about those things. That's been really fascinating. What really struck me about talking with Salim, which I did about an hour ago, was that he talked about how the world has learned 0 lessons since the COVID pandemic, how European countries are sitting on stockpiles of vaccines that would work, but they're refusing to send them to Africa to cut a potential pandemic off at the source. So he is baffled about that, essentially, because he feels like, you can't just wait for a pandemic to come to you. You have to cut it off where it starts. You have to contain it in the first place. By the time it gets to all the countries that are stockpiling the vaccines, it's already too late.
And there's nothing anybody can do about that. There's no instrument, whether it's the international health regulations, the non-existent pandemic treaty, there's no lever that exists in international law or through the United Nations that can actually...
Well, I was looking at this before, and here's something that I read in the New England Journal that's written by our friend Lawrence O'Gostin and colleagues.
You two are so well prepared for this.
And
I've brought literally nothing.
They say, okay, so there are currently 2 Mpox vaccines, which we know about. On August the 9th, the WHO invited Mpox vaccine manufacturers to apply for an emergency use listing, an EUL, which African countries and supporting partners such as Gavin could rely on in deploying vaccines. The United States and other high-income countries have substantial Mpox vaccine supplies, but affected African countries have not had affordable access, an enduring indicator of inequity. And then it just stops there. So I feel like perhaps there was more there that was cut.
Yeah.
But the WHO has tried to invite So that's different to an instrument.
But you see, invite is too polite.
I
So
completely
what about
agree.
name and shame?
Absolutely. So
I
they've
mean, surely-
invited people, and obviously they've refused that invitation.
Tedros is the master of communication. Every day almost there's a
Absolutely.
video of Tedros saying something.
I saw
about
him
something
cooking
around
the
world.
other week.
Really?
Yeah, for his grandkids. It was,
Oh,
it
yes.
was very charming.
That was very sweet.
I don't know what he was doing with a sort of, there
Yes,
was like a
no, I
food
think-
processor, and it looked quite
No,
intense.
he's very good. He's very good. But he needs to apply his brilliant communication skills to holding some of these countries accountable for the vaccine inequity that we're struggling with Mpox, as you're describing, Gavin. And we're too polite, once again, as we were with COVID.
Inviting isn't going to work.
Yeah, inviting ain't going to work.
No one's gonna use
it isn't
it
going to
much.
do that. Whereas if people come out, whether it's Guterres or whether it's Tedros, come out and actually say, look, this is unacceptable. This government is sitting on this amount of Mpox vaccine, and they will know what it is. Then they need to say. And then our friend Sanya Nishtar, who is, new at Gavi,
Yeah.
doing a great job getting to grips with how to evolve Gavi for its next replenishment. But again, she has an absolutely fantastic platform to hold countries accountable. And as somebody coming from Pakistan, and so has enormous moral authority to be able to hold those countries accountable. I mean, I do think these leaders need to, that's why they're in these jobs. That's why they get paid the not so big bucks. That they need to put themselves a little bit at risk and speak up.
Yeah.
But compel is the scariest word in international relations, isn't it?
There is not. I mean, it is shocking, isn't it? I mean, I remember, looking at all of the. I got this huge book on international humanitarian law, which I have read some of, not all of. And the most shocking thing about international humanitarian law is that it's not law, in the sense that it can compel anybody to do it. It's basically just a set of. It would be very nice if we didn't bomb civilians.
Yeah.
It would be very nice if we only proportionately attacked cities. It would be very nice if we didn't target healthcare workers. That's it.
Yeah.
And it really is. It is powerful through its moral authority, but in terms of the legal instruments that we have, as we see around the world, that we are completely unable to stop atrocities, particularly in our field in healthcare, where health workers and health facilities are deliberately targeted, and we can do nothing about it.
And I mean, as we saw with the pandemic treaty, even though the general principles are there, as much as language matters, even the language is being watered down over the last, 20 to 30 years to more shoulds, more, more greyness, more. And we saw that in the pandemic treaty, over and over from the first draft onwards. And I mean, people have commented on that a lot. So even though none of this is binding and it would be really nice. We a lot of, high income countries won't even accept that. They want even more greyness. They want even more sort of cloudiness and weakness in the language so that it really does become completely meaningless.
Yes, I mean, you could almost mount a case that it's not only have we not learnt the lessons from COVID, but countries have learnt lessons that mean we're in a worse position because they now know how to game the system, and they've learnt the way to act purely nationally and not in global concert at all. So it really feels like we've gone backwards rather than forwards, and with Mpox.
They do seem to have learnt that, well, essentially, look at it this way. You've got a series of rational actors, existing individually. One of them goes, I'm going to keep all the vaccines that I have. And the other one goes, well, he's keeping all the vaccines that he has. I'm going to keep all the vaccines I have. And that's the lesson they learned from COVID-19. And now that is an implied action that happens in the case of a pandemic, unless something very drastic changes, it's just going to be what happens every single time. It really, it exposed the sort of world cooperation order for what it is, I think. And now everyone's in it for themselves.
Yeah, exactly.
I think that's the media's, the media's been part of that as well, because they framed politicians and countries during COVID-19 who had quick access to vaccines, either because they were doing, unilateral deals, or they were setting things up internally, or they were well, haven't they been so efficient? Haven't they been great? Canada's done this, America's done this, the UK has done this. And so, of course, there's a precedent there now where everybody wants to be that person who's got quick access to vaccines, because that is the success internally within a country, rather than thinking about it more globally.
And I think that also just it's great sort of setting the world to rights here in this discussion. But just to be a bit self-critical for one moment, one of the things before I went on holiday, I was looking at all of the material that we published on Mpox over the years, which has been a lot. And one of the consistent themes that comes out, unfortunately, is that journals like The Lancet have way too often, privileged voices from high-income countries commenting on Mpox, and not done enough to seek out voices from the countries where Mpox is actually operating and there's a threat. And so if we don't seek out those voices, and if we don't give those voices a platform to hold these countries accountable, in some ways it's not surprising that these countries don't listen, because then it just becomes a conversation amongst us. And we need to, how many times have we actually gone out to say DRC and find health workers there and give them the space to tell their story? And the answer is not enough. So I think that, we have, this is where we have a role in democratizing the conversation more than we have done. It's not easy, and we can come up with many reasons why we might not have done, but that's not good enough. We need to do a better job of that.
Completely agree.
Yeah. And you're doing that with the podcast.
Yes. I mean, I do think one of the points of this podcast, as we've been doing it, coming up on the 5-year anniversary now, is we try and get as many diverse voices in as possible. And I think it's a really good way of doing that under the umbrella of the Lancet, in places where those voices might not necessarily get published. We can have them on. And also, when you have them on for a podcast, you can have all these kind of nuanced discussions that often get lost in scientific writing, in writing short form comments, that sort of thing. So I think it's been one of the joys of doing this podcast for the last few years, is actually getting to hear those voices from around the world as well. We've had an amazing spread of countries on, haven't we, over the last 5 years? So it's it's been fantastic. The other thing I've been doing this week has been trying to edit podcasts in Portuguese.
Okay.
I don't speak any Portuguese. I know.
We have a few Portuguese speakers on our team, don't we?
We do. I go as far as obrigado, and after that, I've got nothing, and I probably pronounced that very badly. But it's actually the amount of podcasts that we do in different languages is actually really quite joyous. We've often talked, haven't we, about the need to spread science and scientific research beyond the English language. And this, again, is one of the easiest ways to do it. We have so many staff at the Lancet who speak a different language from English, and they go and talk to the authors who submit the research, who also speak the same language as them.
So what was the podcast in Portuguese about?
Well, the problem with not speaking the language...
You don't actually know what it is. How do you even edit it?
Who was the editor?
Gustavo from the Lancet Global Health.
Gustavo was at the ESC meeting.
Yeah, so he did the podcast. The issue is we're not speaking Portuguese. I'm not 100% sure what the podcast was about.
Yes. Hopefully it's okay.
Yeah.
But what we do, and this is very boring for the listeners, is I send it back to the editor and they send across timestamps for the bits that need to be removed.
Oh, I see.
Because, if you say in Portuguese, the producer will definitely remove this part, so I've got nothing. So,
yeah.
So this is reaching out to principally Brazil and... but fabulous.
Any Portuguese speakers, it's a global health podcast, so hopefully they will all find it interesting, depending, I guess, on what the topic actually is. But it's something that's really exciting.
And do you have any other languages lined up?
We recently edited one in Chinese.
Yeah. Okay.
There is a second Portuguese podcast coming out, which is the other one that I'm editing, which is for Lancet Regional Health America, so aimed specifically at Brazil.
Have we done anything in Spanish?
Yeah, we've done several in Spanish, actually. If you remember Alaya Astudillo, who worked here,
yes.
she did 2 or 3 podcasts in Spanish for us. I think by this point we've done Portuguese, Spanish, German, French, Chinese.
Yeah.
I reckon that's it, but a good spread of
But
languages.
Spanish is now, I mean, it is I don't know if it's right to say, but it's getting close to the biggest language in the United States, I think.
I think that is right.
Clearly in South America, that is true. It's outperforming in terms of Western education, French and German, in terms of popularity. Okay, we need to do more in Spanish, Gavin.
I think that's a great idea.
Yeah, we're all going to sign up to Rosetta Stone or Duolingo and start
Duolingo.
Improving our
My
our
husband
Spanish.
does Duolingo. He's on his 780th day, I think.
Ah,
But it's kind of, he just really wants the streak, you know, because you get
Yeah.
these streaks. And so sometimes he'll be like, can you do my Spanish home?
yeah. So he's doing
So
Spanish.
he doesn't
He's
lose
doing-
his streak.
He's doing Spanish.
He's doing
Oh,
Spanish.
that's very good. Okay.
How is his Spanish, would you say?
I'd say it's poor to middle on.
Yeah.
Quarter middling's pretty.
I mean-
a lot better than my Spanish.
Yeah.
Oh, but
true.
I mean, I've tried all these Duolingo.
It's hard.
And I mean, seriously, you start off, and how many times are you going to need to know that Philippe has a red bike?
Yeah, exactly.
You know, and
It's about learning
I
the
mean,
principles of
what
I
do you
grammar.
know,
What
but
is it
seriously,
called?
but you know, you learn these phrases, or Charlotte has a
Yeah.
blue something else. I mean, it's absolutely so frustrating and you do this for hours and hours and hours,
It's true.
and you still can't have a conversation with somebody at the end of it.
So I thought that, but I got very far in German Duolingo, and I was like, well, I'm not going to need to use any of this. And then I came across the phrase, I'm in the mood to look at photos of my dog, which in German is, ich habe Lust, den Fotos von meinem Hund zu sehen.
Fantastic.
And that is a
Nice.
phrase I use all the
You
time.
use it all the time. Of course you do.
Apologies to any German
Very good,
speakers
very
listening
good.
for me mangling
Very
that
good,
last
very good.
sentence.
Okay,
Great.
so what are you doing over the next week?
I don't think I've got any external meetings. I'm very interested in Orapush.
Yes, we all should
Very
be.
interested in that.
We all should.
And understanding more about that. I'm looking forward to seeing some research coming through, more and more research coming through on that. I'm obsessed with the American elections.
Yeah.
So, I've got a lot of podcasts myself to actually listen to,
Yeah.
just to get through
Yeah, absolutely.
on a daily basis. And I'm looking forward to the NHS review, the Darcy review, which is coming out in September at some point, date to be confirmed.
Yes, some worrying things I've seen in the news over the last week or so about, people switching to private healthcare, new schemes set up. Bupa set up a new scheme for just 20-something
Yeah.
pounds a month. You can get a private GP at the click of a finger,
Yeah.
which you can't always easily do on the NHS. So yes, I think that the sustainability of the NHS is a big concern. It'll be interesting to see what Ara Darcy comes up with. He did do a very good review of London a number of years ago when he was in the Labour government, Tony Blair's government, as a minister. But nothing ever came of that. So it's going to be interesting to see now whether his blueprint for the NHS, anybody pays any attention to it. I hope they do. He's a good guy and he's got some good ideas.
He is, and I have huge amount of respect for him. I did just feel a bit disappointed that as you say, I mean, he's done a lot of reviews and a lot of things for the healthcare
Yeah.
system over the last 30 years.
Yeah.
And I did think, maybe we could have a fresh voice.
Right. Yeah. No,
No disrespect to,
I think that's
maybe we could have a different perspective
that's
because
perfectly
we have.
reasonable. But this is the guy, remember, that when he went into the House of Lords, almost on his first day, somebody had a heart attack and he had to jump off the benches and save their lives in the middle of the House of Lords.
It's true.
So
It's true. He's a hero.
Yeah. No, because Ara Darcy is a surgeon at Imperial, but when he was in the House of Lords, the average age being about 96,
Yeah.
somebody collapsed and Ara Darcy literally had to jump out of his seat and jump on this poor man's chest to save his life in the middle of the House of Lords. So he has magical fingers and everybody is like rather in awe of him because this is a lifesaver in Parliament. And he does have the ear of government.
He does.
And
he's got a huge amount of resources, people,
Yes, exactly.
connections.
So I think I totally appreciate your point about fresh minds and fresh voices, but he has a network which he could lever, hopefully.
And I think it's difficult to know, isn't it? they're putting this together in 2 or 3 months.
Yeah.
Politically, from the Labour's perspective, is it just they want some documentation? This is the line drawn between what happened under the Conservatives and us. It's an independent review, and anything we can now say, anything from here, this is us, and everything before that is you. So I think it's interesting to know. I think they're commissioned to make a diagnosis.
I mean, they want to work it out before the budget, right? To see what they can actually afford to implement.
Well, they're not going to have it. They're not going to have solutions in a matter of.
It's just a diagnosis. Yeah. It's not. There's no. It's just a diagnosis, really, of what's.
In fact, it's probably going to be a differential diagnosis because there's not going to be one thing that's the problem.
Exactly.
So there's going to be a long laundry list of problems, which will then take 2 terms of government to even begin to address.
I mean, and they will need that because the current state of the government's finances for fixing absolutely anything whatsoever is dire.
Yeah, exactly. Okay, so that's what you're doing.
That's what I'm doing. What are you doing?
I'm going down to Brighton this afternoon. Not for a holiday, but there's a conference on. It's basically about early education for children. So it links into early child development, and they want somebody to tell them a bit about the state of global child health. So I'm doing that on Friday. Brilliant. But then I had this mysterious email last week from somebody who I will not name to keep it totally secret, who said that he is sitting on the most amazing amount of data that will completely transform healthcare in the most spectacular way that you couldn't possibly imagine. So
how often do you get emails like that?
Well, we often get emails saying we've got the most amazing study that you really have to publish, otherwise you'll be completely stupid, or we'll send it to the New England Journal of Medicine. But I don't get emails that are quite so hyperbolic as this one. So as you can imagine, out of my emails after I came back from holiday, that was one I answered pretty quickly. And so next Monday, I'm going to trail off down to X somewhere and sit down and see if his claims do indeed bear out the excitement that I felt when I read his email.
What if it's a trap?
What, you mean he's going to offer us 10 page? Well, I already said he's going to offer us. He's going to offer
now
us.
We know who he is.
No, okay, that rules out 50% of the world's population. So he's going to offer. I think there's going to be. Let's see. For the next podcast, Gavin. For the next podcast.
Yeah, I'm just saying. If you don't turn up for the next podcast, then we'll have some insight.
Will it be quite some time?
Yes.
Maybe tell us offline what the name is, so that we know the leads to follow.
When you turn the record button
on. Well, thank you both for joining us. It's been great to chat with you all on this podcast. I need to work out a better sign-off line, I think. But an absolute joy as ever. And I hope that we can all do this again soon. And I hope that people are still listening by this point. Thanks so much for listening to this episode of The Lancet Voice. You can subscribe to The Lancet Voice wherever you usually get your podcasts. And for more information about this podcast and all of our other podcast channels, please visit thelancet.com/multimedia.